If Medicare Advantage was your first choice when you turned 65, or your first experiment after leaving Medigap, you may have a federal right to change course during the first 12 months. That right can protect access to qualifying Medigap coverage without medical underwriting. But stop right here. This is not a universal promise that anyone can leave any Medicare Advantage plan at any time and buy any Medigap policy they want. The words "first time," your official coverage start date, and the coverage you had before Medicare Advantage determine whether this protection applies. Stay with me, because I am going to break down the two situations, the two separate clocks, the Part D issue, and the exact questions to ask before you make a move. This matters because many people hear two opposite stories. One person says, you can always go back to original Medicare. Another says, once you leave Medigap, you can never get it back. Neither statement is safe as a blanket rule. You may be able to leave Medicare Advantage during an allowed enrollment period, but that does not automatically mean an insurance company must sell you the Medigap policy you want. The trial right is important because in certain first-time situations, it creates a federal guaranteed issue protection. Before we go further, subscribe and turn on notifications if you want Medicare, Social Security, and senior benefit rules explained in plain English. Enrollment periods sound similar, plan documents can be confusing, and one missed date can change your options. First, get the basic distinction clear. Medicare Advantage and Medigap are not two add-ons that normally work together. Medicare Advantage is another way to receive your Medicare Part A and Part B benefits through a private plan approved by Medicare. Medigap, also called Medicare Supplement Insurance, is private insurance designed to help pay certain out-of-pocket costs left by original Medicare. You generally need original Medicare, meaning Part A and Part B, to use Medigap. A Medigap policy does not pay the deductibles, co-payments, or coinsurance of a Medicare Advantage plan. So when someone says, I want to go back to Medigap, the actual transition usually involves leaving Medicare Advantage, returning to original Medicare, obtaining qualifying Medigap coverage, and checking whether a separate Part D prescription drug plan is needed. The first trial right situation begins at age 65. Situation number 1. You joined Medicare Advantage when you were first eligible for Medicare Part A at age 65. Under the federal trial right rule, if you joined a Medicare Advantage plan when you were first eligible for Medicare Part A at 65, and you decide within the first year that you want to switch to original Medicare, you may have a guaranteed issue right to buy a Medigap policy sold by an insurance company in your state. That is a powerful protection. Guaranteed issue generally means the insurer must sell you the Medigap coverage available under that right, must cover your pre-existing health conditions, and cannot charge you more because of past or present health problems. But listen carefully to the boundary. This situation is tied to joining Medicare Advantage when you were first eligible for Part A at age 65 and changing your mind within the first year. It is not a universal 12-month promise every time you join a new Medicare Advantage plan. It is not automatically restarted because you switch from one Medicare Advantage company to another. And it should not be assumed to apply in exactly the same way to someone who first became eligible for Medicare before 65 because of disability. State law may provide additional rights, but the federal situation we are discussing has specific language. In this first situation, Medicare's current Medigap guidance says the person has the right to buy any Medigap policy sold by an insurance company in the state, subject to the normal federal rules about which standardized plans the person is eligible to buy. For example, plans C and F are generally not available to people who became newly eligible for Medicare on or after January 1, 2020. People in that group may have rights involving plans D or G instead. Also remember that Massachusetts, Minnesota, and Wisconsin standardize Medigap differently from most other states. The practical question to ask is this. I joined Medicare Advantage when I was first eligible for Medicare Part A at 65. My coverage started on this date. Am I still within the federal first-year trial right? And which Medigap policies must be offered to me on a guaranteed issue basis? Do not shorten that question to, can I get Medigap? The exact facts matter. Situation number 2. You already had Medigap, dropped it to try Medicare Advantage for the first time, and now want to return. This is the situation many long-time Medigap policyholders worry about most. Medicare says that if you dropped a Medigap policy to join a Medicare Advantage plan for the first time, you have been in that plan for less than a year, and you want to repurchase Medigap, you may have a trial right. Your first option is generally the Medigap policy you had before you joined Medicare Advantage if the same insurance company still sells that policy. That does not necessarily mean the old premium will return. Premiums can change, rating methods can matter, and the insurer must confirm the price and effective date. The right is about access to qualifying coverage, not a guarantee that the price will be identical to what you paid before. What if your former policy is no longer available? Under the federal guidance, you may be able to buy certain standardized Medigap plans sold in your state. The listed federal choices generally include plans A, B, C, D, F, or G, but eligibility for plans C and F depends on when you first became eligible for Medicare. People newly eligible on or after January 1, 2020 generally cannot buy plans C or F and may have rights involving plans D or G instead. This is why the phrase, "I can buy any Medigap plan I want," can be dangerous. The first trial right situation and the second trial right situation do not give exactly the same policy choices. In the first situation, the person may have broader access to policies sold in the state, subject to federal eligibility rules. In the second situation, the first target is the former policy if it is still sold, followed by certain specified alternatives if it is not. The exact question to ask in the second situation is, I dropped my Medigap policy to join Medicare Advantage for the first time. I have been enrolled for less than 1 year. Is my former policy still sold? And if it is not, which Medigap plans can I buy under my federal trial right? Here is where it gets confusing. There are two different clocks. Stop right here and separate them. Clock number 1 is the first-year Medicare Advantage trial period. Remember this number, 12 months. Medicare says the opportunity to drop the Medicare Advantage plan under these first-time trial situations lasts for 12 months after joining the plan for the first time. Your plan's effective date is therefore critical. Do not rely on the month you signed the application, the date you received the member card, or the date you first used the plan. Ask Medicare and the plan to confirm the official coverage start date and the last date on which the trial period special enrollment period can be used. Clock number 2 is the Medigap application window. For these trial right situations, Medicare's Medigap guidance says you can apply beginning 60 days before your current coverage ends or no more than 63 days after that coverage ends. Those dates are not permission to relax. They are a narrow application window, and waiting until after Medicare Advantage ends can create unnecessary stress, confusion, or a gap in supplemental protection. A Medigap policy cannot start while the Medicare Advantage coverage is still active, but you may be able to apply before the Medicare Advantage coverage ends so that the effective dates can be coordinated. That is why the safest sequence is not simply cancel first and shop later. The safer sequence is to verify the trial right, confirm the plan termination date, apply for qualifying Medigap coverage during the permitted window, obtain written information about acceptance and the proposed effective date, and coordinate the return to original Medicare correctly. Do not stop paying premiums, throw away notices, or assume a verbal promise is enough. Keep the Medicare Advantage enrollment confirmation, the plan identification card, the notice showing the coverage effective date, the old Medigap policy information, cancellation notices, letters from the insurer, emails, and any envelopes showing mailing dates. Medicare's Medigap guide specifically warns that documents may be needed to prove a guaranteed issue right. Let us clear up one major misconception by separating this trial right from 3 other enrollment periods. First, the one-time 6-month Medigap open enrollment period. Under federal law, your Medigap open enrollment period generally begins the first month you have Medicare Part B and are 65 or older. It lasts 6 months. During that period, you can buy Medigap coverage without being denied or charged more because of health problems. But this is a one-time Medigap enrollment period. It does not repeat every fall. Second, Medicare open enrollment from October 15 through December 7. That annual period can allow people to join, switch, or drop Medicare Advantage or Part D coverage for the following year. But the ability to leave Medicare Advantage during annual open enrollment does not by itself guarantee that a Medigap insurer must accept you. Third, the Medicare Advantage open enrollment period from January 1 through March 31 for people already enrolled in Medicare Advantage. During that period, a person in Medicare Advantage can generally make one change, including returning to original Medicare and joining a separate Part D plan. Once again, the ability to leave Medicare Advantage and the right to buy Medigap without medical underwriting are separate questions. The trial right connects those questions for certain first-time situations. That is why you must ask about both the enrollment right and the Medigap guaranteed issue right. Do not assume one automatically proves the other. Prescription drug coverage is the next piece, and it is easy to overlook. Most Medicare Advantage plans include prescription drug coverage. Medigap policies sold after 2005 do not include prescription drug coverage. If you return to original Medicare and buy Medigap, you may need a separate Medicare Part D plan. Do not treat Part D as an afterthought. Ask Medicare whether your trial right special enrollment period gives you an opportunity to enroll in a standalone drug plan, when that drug coverage will begin, and whether the prescriptions and pharmacies you use are covered by the plan you are considering. A person can successfully return to original Medicare and obtain Medigap, then discover that the drug plan was not coordinated correctly. That can create uncovered prescription costs or a future late enrollment penalty if the person goes too long without creditable drug coverage. Write down this question: if I leave my Medicare Advantage plan and return to original Medicare, what exact step do I need to take to begin Part D coverage without a gap? Here is the first-year exit checklist. Do not try to memorize 10 disconnected steps. Think of them as 3 phases. First, verify your right. Second, confirm the agencies and insurers involved. Third, coordinate the actual switch. Phase 1, verify your situation and the deadline. Step 1, confirm that this was truly your first Medicare Advantage enrollment for purposes of the trial right. Ask whether you joined Medicare Advantage when first eligible for Part A at 65, or whether you dropped a Medigap policy to try Medicare Advantage for the first time. If you had Medicare Advantage years ago, left it and joined again, do not assume the federal first-time protection restarted. Step 2, identify the exact Medicare Advantage coverage start date. Use the plan's effective date notice, your Medicare account, or confirmation from 1-800-MEDICARE. Ask for the last day on which you can use the applicable trial period special enrollment period. Step 3, call 1-800-MEDICARE and explain the full sequence. Do not say only, "I want to leave my plan." Say, when you first became eligible for Medicare, whether you had Medigap before, whether this was your first Medicare Advantage plan, and when the plan coverage began. Ask the representative to identify the special enrollment period that applies and how the return to original Medicare will be processed. Phase 2, confirm the right with Medicare counseling resources, regulators, and the insurer. Step 4, call your state health insurance assistance program, commonly called SHIP. SHIP provides free personalized Medicare counseling. Ask the counselor to help you verify the federal trial right, identify state-specific protections, and review the timing for Medigap and Part D. State law may provide more rights than federal law, and some states have additional opportunities to change Medigap policies. Step 5, contact your state insurance department. This office regulates Medigap insurers in your state. Ask which carriers sell the qualifying policy, how guaranteed issue rights are documented, and what to do if an insurer denies an application that should be protected. Step 6, contact the former Medigap insurer if you had a policy before Medicare Advantage. Ask whether the exact former policy is still sold. Request the answer in writing. If it is not available, ask which policies the company offers under the trial right alternatives. Step 7, apply during the correct Medigap window and label the application correctly. Tell the insurer that you are applying under a federal Medigap trial, right and guaranteed issue protection. Provide the proof the company requests. Do not allow the application to be treated as an ordinary medically underwritten application if you qualify for guaranteed issue. Phase 3, complete the transition without creating a coverage gap. Step 8, confirm the acceptance, premium, and effective date before the transition is completed. Guaranteed issue protects access and health-based treatment under the qualifying right, but premiums can still vary by company, location, age rating method, and other lawful pricing factors. Compare the same standardized plan letter across more than one insurer when possible. Step 9, coordinate Part D. Verify the drug plan enrollment formulary, pharmacy network, premium deductible, and effective date. Make sure you understand whether enrolling in the standalone Part D plan will trigger disenrollment from the Medicare Advantage plan, or whether Medicare instructs you to submit a separate disenrollment request. Step 10, keep a transition folder. Save every letter, notice, email, application confirmation number, and effective date statement. Write down the date and time of each call and the representative's name or identification number when available. If something goes wrong, those records can be the difference between a quick correction and a long dispute. Three questions come up again and again. Let me answer them plainly. Question 1. Does this apply after 12 months? Usually, the federal first-time trial right is tied to the first 12 months. After that window, you may still be able to leave Medicare Advantage during another enrollment period, but you may not have this federal Medigap guaranteed issue protection. An insurer may be allowed to use medical underwriting, deny the application, offer fewer choices, or charge more, depending on the situation and state law. However, other federal guaranteed issue situations or additional state protections may apply, so do not assume the answer is automatically no. Ask SHIP and your state insurance department. Question 2. Can I get my old Medigap policy back? If you dropped Medigap to join Medicare Advantage for the first time, stayed in Medicare Advantage for less than a year, and the same insurer still sells your former policy, the federal trial right may allow you to repurchase it. If that policy is no longer available, certain other Medigap plans may be available under guaranteed issue. The premium may not be the same as before. Question 3. Will health questions apply? An application may still contain health questions, but if you qualify for a guaranteed issue right and apply within the required window for an eligible policy, the insurer cannot deny you because of past or present health problems, cannot charge you more because of those health problems, and must cover pre-existing conditions without a waiting period. Make sure the insurer knows you are claiming a guaranteed issue trial right and provide the documentation it requests. Here is the full picture. The federal 12-month trial right is real, but it is not a universal escape hatch from every Medicare Advantage plan. It commonly protects two groups: people who join Medicare Advantage when first eligible for Part A at age 65 and changed their minds within the first year, and people who dropped Medigap to try Medicare Advantage for the first time and want to return within that first-year period. The 12-month plan change window and the Medigap application window are related, but they are not the same. Confirm your exact coverage start date. Apply for Medigap during the permitted period, which may begin 60 days before your Medicare Advantage coverage ends and generally closes no more than 63 days after it ends. Check Part D. Keep every notice. And do not cancel current coverage based on an advertisement, a comment, or a vague promise that you can always get Medigap later. Call 1-800-MEDICAR, your local SHIP, and your state insurance department. Ask the former Medigap company whether your policy is still sold. Get acceptance and effective date information in writing before the transition is completed. If you help a parent, spouse, neighbor, or older relative with Medicare, share this with them before the first-year clock runs out. And in the comments, tell me which part causes the most confusion: the 12-month deadline, getting the old policy back, or the Part D step. Do not post your Medicare number, health information, address, or policy documents. Subscribe for more plain English Medicare and senior benefit alerts. One carefully timed phone call can protect choices that may be much harder to recover later.